Hi all, I'm Faith Jackson, the Racial Equity Coordinator for the City of Bloomington, and I'm here again to give you an update on the racial equity work occurring in our city. A few months back, I introduced the Racial Equity Strategic Planning Committee. You may recall that this is a committee that's comprised of nonprofit representatives, business community representatives, representatives from the Bloomington School District, residents, city staff, and also a council liaison. And this group is charged with developing recommendations for how the City of Bloomington can disrupt and hopefully eliminate racial disparities within the 5 domains of the social determinants of health.
In the fall of 2020, the council took a step to declare racism a public health crisis, and within that we had very tangible next steps that we were going to take as a city that we were committing to, because we wanted to make sure that we weren't just passing a resolution, that we were really passing something that had teeth and commitment behind it.
We are here today to develop prototypes for the work that we have been doing for several weeks around the social determinants of health that the City of Bloomington has identified, along with data and concerns from citizens coming together to really talk about what is needed to increase opportunities for all to thrive in the City of Bloomington.
So I am serving on the Healthcare Committee. I came to do this work because of my position on the City Council and the desire that we have a council member part of this process so that we're continually making that connection between what the council is doing and saying and thinking about and what the Racial Equity Steering Committee is also doing.
I am honored to be on this committee because my first time in it, and we were on Zoom meetings. So just to see all of the people in here, I was like, the CEO of Veep is here and Dean is here, and oh my gosh, there's an actual city council member here. So that's when I knew things were going to be different. And then I thought it was really interesting just to learn about how things like this work within a city.
I'm young and I don't know a lot of that stuff, so it's good to hear from adults and people who actually do know the stuff to get more information so that when I'm older, I know more stuff.
The meetings were structured to provide data and information regarding the 5 social determinants of health. We brought in an expert, a speaker, it may have been more than one person, that really provided detailed information, not only about the City of Bloomington, but overall regarding this, what's happening at the state level, and then bringing it into the community of Bloomington. Our groups were divided into 5. So the committee members selected an area of focus that they wanted to work on based on those 5 social determinants. Each group then would come together and develop what we call a prototype, identifying what's working well, what's not working well, what are the gaps, what might be some innovative ideas for addressing those gaps in services, and then developing an entire prototype for those services.
Oftentimes, what I've heard in my feedback as a professional and as a council member is that we ask communities over and over again for input and feedback, but it's not always clear how that feedback or that input is incorporated into the decision-making process. And so as a council in Bloomington, we are very much committed to making sure that the community's perspective, voices, leadership is valued, it's heard, and then whatever decisions we end up making as a council, that our community members, our leaders in our community understand why those decisions were made.
I have been doing this work for a while now. This has been the most thorough process and most integrated process I have ever seen.
Well, I hope to make a change, you know what I'm saying? Because we need that. We need a little bit of a change. And I hope they really just listen, and it's not just hearing us and then, moving on. I hope they actually take it in and do something with the information that we give them.
I see the different problems my students deal with, and I can only do so much as a teacher. And so having the resources of the city, being able to make these issues easier for my students or to actually solve them is, if I could see even just a little bit of change in our education and in the lives my students are living in Bloomington, I'd be happy.
People are so committed to this community. They want Bloomington to thrive. They want to see all people become successful. And they're committed because I'm seeing it, the energy and the synergy. They're building relationships and they didn't even know each other, with each other, and yet to be able to come together and begin to dialogue and develop prototypes for how to make the community better is an amazing, amazing process.
If this is your first time hearing about the work of the committee, or your first time learning about racial equity work that's occurring in the city, I encourage you to check out our city website. In addition, I encourage you to check out our YouTube channel. We have an array of videos there that cover many different topics, and it will give you a comprehensive overview of the racial equity work that's occurring in the city of Bloomington. Thanks for watching.